My name is Peter Witt. I'm a neurosurgeon by training, and I'm the director of the Neurospine program here for the Department of Neurosurgery. It would be unrealistic to expect to have no pain after these surgeries. What we want to help with is to mitigate that pain. We use narcotics sparingly but efficiently to keep that worst ever pain that some patients experience at a tolerable level so that we can start with a rehab right away after surgery. The side effects of narcotics include addiction, sleepiness, nausea, vomiting, and constipation. Radicular pain is the pain caused by pressure and irritation of the nerve root. And that radicular pain is the pain that patients experience when they say it's that pain that shoots all the way from the buttocks all the way down into the foot. We would like to also then use longer-term medication, nerve pain addressing drugs like Lyrica, gabapentin, and Tylenol. These help with the neuropathic pain, the radicular pain. The muscle relaxers are being used, especially in the postoperative period, to deal with the muscle spasm that happens from the surgery itself. Ice and heat is being used also as a pain treating strategy after surgery. Ice specifically to combat inflammation after surgery. Heat can also help with muscle spasm. The pain is to be expected. There's no good medical treatment to eliminate the pain completely from the postoperative period.
So once you're discharged from the hospital and you're home, if you need a refill of your pain medication or your muscle relaxers, any of your prescriptions, please give us at least 2 days. Call the office or send in a My Health Connection message through the portal, and we'd be happy to get those for you. After fusion surgery, we ask that you stay off NSAIDs, and that is any ibuprofen, Motrin, Aleve, naproxen. There's so many of them. We ask that you're off for at least 3 to 6 months as they delay bone healing. So anytime you have surgery with our orthopedic surgeons, they ask that if you have any dental work within a year of surgery, that you call the office and let us know, and we'll give you a prescription for a one-time antibiotic to take 1 hour before any dental cleaning or any kind of dental work. So anytime you are on narcotics, you're going to be constipated. So that's why we want you to take a stool softener, once in the morning and once at night, and then maybe some Senokot. Or sometimes we give you some Glycolax, which is a powder that you mix with water that you can take every day. Also, you're going to need to drink plenty of water. Make sure you're always drinking water. Limit your caffeine intake. High fiber diet. Those are all things that can get you through the problems with constipation. Some of the medications that you're really going to need are things like the vitamins, vitamin C, vitamin D. We're going to send you with prescriptions of those, plus stool softeners while you're on narcotics. Those medications are not covered by insurance, and you will need to purchase those at your local pharmacy.
Your outer dressing can be removed 5 days after surgery. After you remove the outer dressing, you might find an inner dressing called a Hypafix, Steri-Strips, or staples. If you have Hypafix or Steri-Strips, these need to stay in place for 10 to 14 days. If they start to peel up and come off, that is okay, but do not remove them yourself until the 10 to 14 day period. If you have staples, you'll need a nurse visit at 10 to 14 days post-op. If this is not already scheduled, please call our clinic and we'll be happy to schedule a visit. If you have a wound vac, these are typically removed 2 weeks after surgery. If you do not have an appointment scheduled, give the clinic a call. If you have any problems with the wound vac, please call us. Do not remove or replace the dressing yourself at home. Once you remove the outer dressing at 5 days post-op, make sure you're showering daily. The incision is allowed to get wet. You'll let warm, soapy water run over the incision. You do not want to scrub the incision. Once you're done, pat dry. Do not use any lotions or ointment on the incision site. Also, make sure to not submerge the incision until it's fully healed. So that means no getting in the bathtub, hot tub, or a swimming pool. This is generally around the 6-week time frame. You'll want to monitor your incision daily for any signs of infection. This includes a fever greater than 101, any drainage. This could include pus-like drainage, odorous drainage, or bloody drainage, or an increase in drainage. You'll also want to look for any redness or warmth around the incision site.
If you have staples in, normally it's staples, rarely people will have sutures after surgery. You will need an appointment with us within 2 weeks of surgery so that we can remove those here in the office. So normally you will have a 6-week follow-up appointment scheduled for you before you leave the hospital. If you get home and you notice that's not on your paperwork, please give us a call and we'll be happy to schedule that for you. The Spine Clinic triage nurses are available Monday through Friday from 8 a.m. to 4:30 p.m. And you can call our main number at 720-848-1980. If you have any post-op issues that are after hours or on the weekends and you don't feel that you should wait to talk to somebody until the next business day, then you can call the after hours number at 720-848-0000. Ask for either the ortho spine or the neuro spine resident on call and someone will call you back. All right, so now we're going to talk about when to call the doctor. So if you have a temperature greater than 101, then you'll need to call. If you develop any pain in your chest, especially when taking a deep breath, if you develop any difficulty in breathing or swallowing, if you develop any thick, white, yellow, or foul-smelling drainage from your incision, any confusion or unusual changes in behavior or memory, new or increased weakness or difficulty walking, new or increased hand weakness or clumsiness, pain, redness, or swelling in your calf. And the discharge paperwork is very important. You will go home with a packet. It'll have your follow-up appointments on it. It will have your medications on it. It will have wound care on it. It will have your activity. And it's very important to keep that handy and refer to it often. If you have more questions after that, then please do call us at the office.